FND can look like stroke. People with FND may present suddenly with weakness or paralysis on one side of the body, numbness or altered sensation on one side, speech difficulties, slurred speech, word finding issues, stuttering, or speech arrest, vision changes, double vision, tunnel vision, or partial blindness, gait or balance problems. How clinicians differentiate FND from stroke with imaging. Brain imaging, CT or MRI, usually shows changes such as bleeding, clot, or evidence of ischemia to indicate stroke. With FND, imaging is normal. No structural damage is shown. Onset and course also differ. With stroke, there is sudden onset, usually maximal at onset, often with vascular risk factors such as hypertension, diabetes, or smoking. FND onset can also be sudden, but symptoms may fluctuate and improve temporarily or worsen under stress. Neurological exam signs that are positive signs of FND include inconsistency. Symptoms vary over time or with distraction. Hoover's sign. In leg weakness, if a patient is asked to push down with the weak leg, it doesn't work. But when asked to lift the opposite leg, the weak leg then pushes down normally, shows preserved motor pathways. Collapsing weakness. The limb gives way suddenly despite being able to hold briefly. Non-anatomical patterns. Numbness or weakness doesn't follow standard nerve distributions, for example, a stalking glove, sensory loss pattern, rather than nerve or spinal levels. When to call 911 or go to the ER. Possible stroke or medical emergency. Use the FAST acronym plus additional red flags. FAST stands for face, sudden drooping, numbness, or asymmetry. Arm, sudden weakness or numbness in one arm or one side of the body. Speech, sudden slurred speech, difficulty speaking or understanding words. Time, call 911 immediately if any of the above are present. Other red flags. Sudden severe headache, worst headache of life. Sudden loss of vision in one or both eyes. Sudden severe imbalance, dizziness, or collapse. Loss of consciousness. Chest pain, shortness of breath, or severe confusion. These signs always warrant an ER visit, even if the person has FND, because a stroke or other medical emergency must be ruled out. When it might be FND and not an emergency. Clues the family member might notice that suggest FND rather than a stroke, but should still be cautious. Symptoms have happened before and follow a familiar pattern. Symptoms come and go, fluctuate, or improve with distraction. Normal speech comprehension, even if speech sounds stuck or effortful versus slurred or nonsensical in a stroke. Weakness that changes when the person is not focusing on it, for example, can move leg while shifting position, but not when asked directly. Symptoms occur during or after stress, fatigue, or sensory overload.